is called a little privacy screen here, and we did this because when we had the mock-up done, we had some people that were sitting here, and they said, really, from here you can see all the way through, and if I wanted to breastfeed while I'm sitting in the chair, so forth. And this privacy screen was made so that mom has just a little bit of a barrier between her and the hallway. And so it works out really nice. It's out of a fabric, and we wrote on it today and everything, so it could be a little communication flag as well. And so it would be here just so mom would have that little bit of extra privacy when she is sitting here. And she's not, taken out of the mainstream of what's happening in the room. She's just got that little bit of extra support and privacy.
I don't know if you've noticed how much we're talking about breastfeeding today, maybe ad nauseum for you. Breastfeeding used to be like a nice thing to do, sort of the hippie mother image, or the earth mother's breastfed. After years of research, now we know that mom's own breast milk is absolutely optimum nutrition, and also the best way to support the baby's immune system as a baby, as a toddler, as a child, and even into adulthood. There's a correlation between adult health and whether or not the child was breastfed, and there is no replacement for it. Our culture doesn't always support that, and particularly when a mom-baby dyad are separated at birth, it's really hard to sustain breastfeeding because all of these moms have to pump. They have to pump long-term, just as if the baby were nursing. They have to pump that many times a day. So we need to make it possible for them to do that and support them, because it is grueling. It is absolutely the best thing for the baby. So we support it whenever we can, and we're the cheerleaders. So it's actually a health science initiative to support breastfeeding whenever possible.
Yeah, my alma mater, the Medical College of Georgia in Augusta, actually has made it a policy now that every premature infant, the mom will pump her, pump if she cannot breastfeed at the beginning. She will pump, and they will receive the milk, and they will feed it to the infant. There is not one infant that goes into the neonatal ICU that does not receive breast milk from their mom.
And if she doesn't give it, a lot of them use donor milk.
Donor milk, yeah.
So they're going to get this that serious. It's, like I heard the neonatologist say, he tells them it's like medicine. So even if they come in the antepartum and they didn't really want to breastfeed, by the time they kind of get the story
they do.
of what they need and how this is going to make their baby get better quicker, they want to. So we want to create an environment that we don't unintentionally create barriers. And we don't do it on purpose, but sometimes by the design of things and the way things are set up, we create barriers which makes her growing the child quicker. Yeah. But if we set it up...
You have to understand, usually the first time experience for a woman in a hospital is when she has a baby. Mm-hmm. That statistics prove that about 78% of women, have really never been a patient in the hospital until they come in and experience childbirth. So this is their first experience in the hospital. And we want it to be a very positive one for both mom, baby, and dad.